All right, we're here today with Gwen. Gwen's been a patient in our office for about 4 to 5 months now. And when she first came in, she was someone who suffered with migraines like so many other people do for a very long time. So Gwen, tell us a little bit about what was your life like before you got here and what's happened since you started your treatment program.
Okay, so I've had migraines since I was about 9 years old. Have suffered with them to the point of extremes off and on throughout my life, and had gotten to the point that I was having them daily and had resorted to using Botox for migraines to alleviate some of the symptoms. But I was having other health issues and really wanted to find out what was causing all my problems. And came here to see Dr. Lawrence, and she started looking, or you started looking through what the issues were. And since then, have gotten to the point that my migraines are very infrequent and much less severe than they've been ever in my life. And I feel like I have better control over what happens with the migraines.
Right. One of the things that we found was that yours had a lot of blood sugar correlation. So now that you know that, you can be more aware.
Yes, and I really have paid a lot of attention to the foods that I eat, how often I eat. I make sure that I have protein 6 times a day. I eat snacks throughout the day, and try to keep them between 2 and 3 hours as far as distance between the meals, and that seems to be helping significantly.
Yeah, so I noticed that, like, initially, like you said earlier, you were getting them really pretty frequently to the point where you were getting Botox injections.
Right.
Which would alleviate it, but you still would get them.
Yes.
And now I see you've gone, I think what's the longest? It's been 2 or 3 weeks?
About 3 weeks in between, which is very unusual because most times the migraines would be 2 or 3 times a week.
Right.
So it's been a great relief not to have experienced the migraines as frequently.
Excellent.
It makes my life a lot easier, makes my capabilities of doing my job a lot easier.
Sure.
And I feel a whole lot better.
Awesome. Did you notice any difference in your energy or your sleep or digestively?
Absolutely. I had digestive issues that were pretty annoying, and I felt that all the time. I almost felt like some of the digestive issues were contributing to the migraines as well.
Sure.
And since I've started coming here, we've kind of worked with the digestive system and trying to get it back on track, and I feel much, much better.
Good.
My energy level is much higher than it has been in years. I feel like a different person. It's been a long time since I've felt this good.
Yay.
Yay.
We always like to hear that. Excellent. If you knew of anybody else, and of course you have, because you've referred someone to the office already that has migraines, but if there were other folks out there that were suffering with headaches, with migraines, what would you recommend?
Come see you. Come see Dr. Lawrence. And I have made it a point that anybody I know that has issues to let them know that there is someone out there that can help. I've had just phenomenal success here. I've been to doctors, many doctors over the years, trying to find out why I felt the way I did with no success at all. They wanted to hand me another pill to take. So this has been a very positive experience for me, and I'm excited by the fact that I feel so much better, and my husband is really excited about the fact that I feel so much better. So this has been a great experience for me.
So the difference here is that we're, like our tagline says, we get to the root cause of your chronic health condition, and that's what we did. We got to the root cause by doing a lot of testing, and for really being hyper-focused on everything that you do in your daily life. And when we've put all those things together, we're able to figure out what the root cause is, and when you can address the root cause, then you get rid of the problem.
Absolutely. And I feel like that's what you've done, is really taken a look at my life and my health and my issues, and really focused on my situation instead of just looking at a problem and handing a pill over. So this has been great, just to know what's been causing the issues and to be able to help manage that myself as well. It's been really, really positive.
Awesome. Well, thanks, Gwen. I appreciate it.
You're welcome. Thank you.